What if I told you that your health insurance already pays for hundreds, sometimes thousands of dollars in medical care every single year, and most Americans never use it? Not because they don't need it, not because they don't qualify, but because no one ever explained it to them. Think about this for a second. People skip doctor visits because they're trying to save money. They avoid screenings because they feel fine. They delay checkups because they're afraid of surprise bills. And quietly, year after year, they lose access to free preventive care they already paid for in premiums. Annual physicals, blood tests, cancer screenings, mental health check-ins. All covered, all available, all ignored. And here's the real problem. By the time most people finally do go to the doctor, the problem is no longer cheap or easy to fix. What could have been a $0 screening becomes a $6,000 procedure. What could have been a simple lifestyle change turns into lifelong medication. What could have been caught early turns into months off work, stress, and medical debt. Today, I'm going to show you how preventive care isn't just about staying healthy. It's one of the most powerful money-saving tools hidden inside your health insurance plan. And once you understand how it works, you'll never look at your benefits the same way again. Let's be honest, health insurance in the United States is confusing on purpose. Most people are never taught how it works. Not in school, not at work, not when they sign up. You're handed a card, a premium, a deductible, and a giant booklet of fine print hand. Then you're expected to figure it out while juggling work, family, and life. So most Americans use insurance the same way. They only think about it when something goes wrong. You get sick, you get injured, you go to the ER, you brace yourself for the bill. But preventive care flips that entire mindset upside down, because preventive care isn't about reacting to illness. It's about preventing expensive problems before they ever happen, medically and financially. And here's what most people don't realize. Under U.S. health insurance law, many preventive services are required to be covered at no cost to you. No deductible, no copay, no coinsurance. Yet millions of Americans either don't know these benefits exist, assume they'll cost money, or accidentally turn free care into paid care by asking the wrong questions. That's not your fault. The system isn't designed to make this easy. But once you understand how preventive care actually works, what's covered, how to use it correctly, and how to avoid billing traps, you gain something incredibly powerful. Control. Control over your health. Control over long-term costs. Control over medical surprises that destroy budgets and peace of mind. In this video, I'm going to break down preventive care in plain English. No medical jargon. No insurance fluff, no scare tactics. You'll learn what preventive care really includes, what's truly free and what isn't, how to use these benefits without triggering surprise bills, and how using preventive care today can save you thousands of dollars over your lifetime. So if you've ever avoided a doctor visit because you were worried about the cost, if you've ever wondered whether insurance actually works in your favor, or if you just want to stop overpaying for healthcare, you're in the right place. Language and structure are designed to keep us viewers watching, nodding, and rethinking how they use health insurance. When most Americans hear the phrase preventive care, they think it means one thing: an annual physical, maybe a quick checkup, maybe a flu shot. And that misunderstanding alone costs people thousands of dollars over their lifetime. Preventive care is not extra health care. It's not optional. And it's not a bonus your insurance company generously throws in. It's a legally required category of services that insurance plans must cover, often at zero cost to you, because preventing disease is dramatically cheaper than treating it later. Preventive care includes services designed to catch problems before symptoms appear. That's the key difference. Once symptoms exist, care often shifts from preventive to diagnostic, and that's when costs kick in. Preventive care includes things like annual wellness visits, blood pressure and cholesterol screenings, diabetes screenings, cancer screenings, breast, colon, cervical, prostate vaccinations, mental health screenings, obesity, and smoking counseling. Certain lab tests, these aren't random freebies. They're based on decades of data showing that early detection saves lives and money. But here's the problem. Most people use insurance reactively. They wait until something feels wrong. By then, they've already missed the window where care would have been free. Insurance companies don't remind you to schedule screenings. Doctors don't always explain what's preventive versus diagnostic. And no one teaches you how to ask the right questions to keep care fully covered. So people assume, if I feel fine, I don't need to go. Or worse, if I go, I'll probably get a bill. That mindset is exactly what turns preventable conditions into expensive chronic problems. Preventive care is not about paranoia. It's about playing the long game medically and financially. Once you understand that preventive care is built into your plan whether you use it or not, everything changes. Because if you're paying for it anyway, not using it is the most expensive choice of all. You've probably heard this phrase before. Preventive care is free. That statement is technically true and dangerously misleading. Preventive care is covered at no cost only when it's billed correctly and used correctly. This is where millions of Americans get burned. Here's how it works. If a service is classified as preventive under federal guidelines and you meet eligibility criteria, age, gender, risk level, your insurance must cover it without charging you a deductible, copay, or coinsurance. But one wrong step can flip that switch. Example, you go in for your free annual physical. During the visit, you casually mention chest pain or chronic fatigue. Suddenly, the visit becomes diagnostic. That blood test that would have been free, now it applies to your deductible. Same test, same doctor. Very different bill. This doesn't mean you should hide symptoms. It means you should understand the difference between preventive and diagnostic care, how to separate visits when needed. Preventive care is proactive. Diagnostic care is reactive. Another common mistake, not knowing what's included. Many people assume labs always cost extra, but basic screenings like cholesterol, blood glucose, and blood pressure are often covered when done as preventive services. Vaccines, covered. Cancer screenings at recommended ages, covered. Mental health screenings, covered. But only if you schedule and code them properly. Insurance companies don't explain this up front. They rely on confusion, and doctors are focused on care not billing optimization. That's why smart patients ask one simple question: is this being billed as preventive? That question alone can save hundreds, sometimes thousands of dollars. Free preventive care is real, but it's not automatic. It's a benefit you must use intentionally. Once you understand that, you stop fearing doctor visits and start using insurance the way it was designed. Preventive care doesn't just save you money this year, it saves you money every year after that. Think of it like compound interest, but for healthcare. Catching high blood pressure early might cost $0 in screenings. Ignoring it can lead to heart disease, stroke, or kidney failure conditions that cost tens of thousands of dollars. A $0 colonoscopy at the recommended age can detect polyps before they become cancer. Treating colon cancer, that can cost six figures. Preventive care reduces emergency room visits, hospital stays, expensive procedures, long-term medication dependency. But the biggest savings most people miss is this: avoiding chronic conditions that lock you into lifelong costs. Once a condition becomes chronic, you don't just pay once, you pay every year. Deductibles, prescriptions, specialist visits, time off work. Preventive care breaks that cycle before it starts. And there's another layer people don't consider. Insurance pricing. Health outcomes affect claims. Claims affect plan pricing. Plan pricing affects premiums. The healthier the insured population, the lower overall costs stay over time. Preventive care isn't just personal, it stabilizes the system. But insurance companies Dan T advertise this aggressively because short-term savings for you, Dan T, always means short-term profit for them. So the responsibility falls on you. Preventive care isn't exciting, it's not dramatic. But it's one of the few areas in healthcare where logic, health, and money all align. Use it consistently, and you'll spend less not just on medical bills, but on stress, missed work, and financial surprises. This is one of the most important distinctions in all of health insurance, and almost no one understands it. Preventive care is designed for people without symptoms. Diagnostic care is used to investigate a problem after symptoms appear. Same test, different intent, different cost. Here's why this matters. Insurance billing codes are based on why a service was performed, not just what was done. If you get a mammogram as part of routine screening at the recommended age, it's preventive. If you get the same mammogram because you felt a lump, it's diagnostic. Preventive, $0. Diagnostic, deductible, plus coinsurance. Neither is wrong medically, but financially, they are worlds apart. This is where planning matters. You don't avoid care, you structure it. Many people benefit from separating visits. One visit strictly for preventive services, a separate visit for ongoing concerns that allows preventive benefits to remain intact. Another common trap. Lab tests ordered just to check something. If there's no documented preventive reason, insurance may treat it as diagnostic heaven if the test itself is normally covered. This isn't about gaming the system. It's about understanding it. Preventive care only works financially when the intent is clear. Doctors want to help you. Insurance companies want documentation. You are the bridge between the two. When you understand how one word, preventive versus diagnostic, changes everything, you stop being surprised by bills. You become proactive, not reactive. When people think preventive care, they think blood tests and physical exams. But mental health is one of the most overlooked and most powerful preventive benefits in modern insurance plans. Depression screenings, anxiety assessments, substance use evaluations. These are often fully covered. Why? Because untreated mental health issues lead to higher medical costs, lower work productivity, increased emergency care, long-term disability claims. Preventive mental health care catches problems early before they escalate into crises. Telehealth has made this even more accessible. Many plans offer $0 or low-cost virtual mental health visits, free screening tools, wellness coaching. And yet, people don't use them either due to stigma or lack of awareness. Mental health preventive care isn't about labels, it's about resilience. A single preventive screening can prevent months or years of struggle and cost. Ignoring mental health doesn't save money. It delays the bill and makes it bigger later. Using preventive mental health benefits is one of the smartest long-term financial decisions you can make. Here's the practical playbook. Before your appointment, confirm the visit is preventive. Ask which services are included. Verify in-network providers during the visit. Keep preventive visits focused. Ask if additional tests will change billing requests, separate appointments if needed. After the visit, review the explanation of benefits, look for incorrect billing appeal, errors. Many get reversed. Preventive care isn't passive. It requires participation. But once you learn this rhythm, it becomes second nature. You stop fearing appointments. You stop avoiding care. You start using insurance strategically. And that's when savings compound. Most people skip preventive care to save money. In reality, they're choosing the most expensive path. Preventive care costs time. Skipping it costs money, health, and peace of mind. Insurance already priced preventive care into your premium. You paid for it, whether you use it or not. Not using it doesn't lower your premium. It just increases your risk. Preventive care is one of the few guaranteed returns in healthcare. Ignore UTAND, you pay later. Use ETAND, you control the outcome. This isn't about fear, it's about leverage. Preventive care isn't just about staying healthy. It's about staying in control. Control over your health. Control over your finances. control over a system that profits from confusion. If this video helped you see preventive care differently, subscribe for clear, no-fluff insurance breakdowns. Like this video so more people stop overpaying. Comment below with your questions I read and reply to everyone. Your health matters. Your money matters. And now you know how to protect both.